Pets and Vets.
On Afternoons with Helen Farmer.
In association with Royal Canin, the trusted expert in nutrition for your cat and dog.
It is truly one of my favourite hours on the show. Pets and Vets brought to you by Royal Canin. Let's talk about your fur baby. Send me photos of them. Tell me all about them. And of course, if you've got any questions or concerns, we've got a vet on hand to answer them. 4001. Use the ARN Play app. You can attach photos there, of course, or give us a call 04871 5500. Anyone who texts in gets a chance to walk away with a Royal Canin goodie bag, and try and let me know what your name is, but most importantly, what your pet is called too. Joining us live on Microsoft Teams is Dr. Nicoleta. She is at Modern Vet. How are you, Doctor?
Hello, hi, I'm very well, thank you.
Thank you for being with us this afternoon. Before we get to the text, and we have had a lot, and many about cats this afternoon. Nicoleta, what animals do you have at home? Can you tell us about your pets and what their names are?
Well, actually, I've just adopted a pet from the clinic not long time ago. Because of course all the vets, this is what we do usually. We just take some lost animals from the hospital. So I do have a cat, a 3-leg cat at home. She's just 2-3 months old. Her name is Lou, and she's very, very lovely. And also because I'm coming from UK, there I had a Springer Spaniel dog, 2 years old Springer Spaniel, and also in 3 legs. Seems that I have something.
I love it. You've got this is your trend to go for the cute tripod animals. Springer Spaniels are a very special breed. You've got to have a lot of energy. They are bright dogs, and they love jumping up. I've got 2 Cocker Spaniels, and as I said, Dr. Nicoleta, we've just moved house over the weekend, and our dogs have gone from sleeping in a kitchen, kind of enclosed space, to now our new place is a bit more open. Oh my goodness. I wondered if you had any advice on helping them settle into a new home. We tried a calming spray, didn't really work. I'm now thinking about doggy Xanax because I really, really, really don't want to upset our new neighbours. Any tips?
So it really depends sometimes how they do react, but what usually will say just to try to play with them and interact with them as much as possible. I know with probably everyone is working quite a lot, so then they will need to stay at home maybe for a longer period of time. But it's good at least when you are at home to play with them and interact as much as possible, so they will forget the fact that they are in a new environment. Take them to walks, and also I'm pretty sure that here in Dubai you will find a lot of doggy daycare, or maybe people they take dogs on walking, so that will be good for them, even for the exercise and everything. Indeed, there are some sprays like Feliway for cats or Adaptil, and a lot of products just to, let's say, the pheromones to put in the house. For them to, let's say, feel better. For some of them, they will work. For another ones, they are not going to actually work that much. But I think the most important is the attention that we are giving to them. Because the Xanax and other products, it might be maybe, yes, in extreme cases. But for, let's say, the less invasive products, it will be actually just to play with them and interact.
Oh, right.
And the love.
Lots of attention and distraction then. I'll get the kids on it later. Going to the text line, 4001, if you've got a question for Dr. Nicoleta at Modern Vet. Message here saying, my cat was recently diagnosed with FIV. It's like HIV in humans. Is it transmitted to other cats or humans, and what precautions should we be taking? Thank you for that great question. Sorry about the diagnosis, but hopefully Nicoleta can help put your mind at ease.
Yes. So indeed, unfortunately, I've seen that in this country there are quite a lot of cases of FIV cats because there are lots of the streets, and it is indeed dangerous for transmitting for the other cats in the same household. But they can still live with this condition. So let's say for a few years, that's fine. But ideally is just to be kept as an only pet, or just to be aware that if it's going to pass to the other cats, they might just contract that as well. It's not great, for example, for people that are taking from the street animals, and then we are going to diagnose that unfortunately they are FIV positive. We need to understand that we cannot return them back on the street, because that will mean that we are going to spread and we cannot control that anymore. It's not something easily to transmit, so it's not going to be through the air, for example, but in case of a bite, then it might be transmitted.
Okay, so biting, bodily fluids, all that kind of transmission is something you need to be super careful of.
Yes.
Okay, really hope that helps. Lots coming in on 4001. Dr. Nicoleta with us this afternoon to answer your questions. A message here saying, my cat after being spayed is getting bigger and bigger. She will not stop eating. Claudia's got a 3-year-old Siberian forest cat, healthy and happy, but sneezes a lot. Could it be an allergy? And when should we worry? Get in touch with us this afternoon. We're answering your questions, free advice and the chance to win a Royal Canin goodie bag. We're going to your messages next.
Join the conversation on Afternoons with Helen Farmer.
Only on Dubai Eye 103.8. Pets and Vets.
On Afternoons with Helen Farmer.
In association with Royal Canin, the animal before the owner.
And joining us live on Microsoft Teams from Modern Vet, we have got Dr. Nicoleta Nica. She is here to answer your questions, hopefully put your mind at ease about any symptoms you've spotted in your pets, or maybe you just want to share a story about your animal. However you get in touch, you're in the draw to win a goodie bag from Royal Canin. Use the text, use the app, or give us a call. Message here, and we've had quite a lot about cats today. One saying, after my cat got spayed, she's getting bigger and bigger, won't stop eating. How can we control her weight? After sleeping, she will eat. After going to the litter box, she will eat. Walking will eat. Playing will eat. She's bored, she will eat. She's sleeping now. When she wakes up, she'll eat again. I think I found my spirit animal. Is this common after spaying? And what can be done in order to curb the feasting?
Yes, this is very common to happen. And the simplest solution is do not give that much food. That would be very easy. So don't put the food down to be available all the time. Just divide the normal food requirement per day and split that meal into, let's say, 2 or 3 meals, and you will offer it twice or 3 times per day. Also, with the treats, for example, if you still want to give treats and you don't want to cut that completely, you can give healthy treats like maybe small pieces of chicken breast that you can boil them and just cut them, and you can offer that 2 or 3 times per day. So that will be a nice and healthy treat. And keep them active. So indeed, they will tend to gain some weight after spaying, but it's important to reduce the food so not to be available all the time.
So more of a grazing platter than 3 courses, 3 meals a day. Hope that helps. And Claudia's been in touch on 4001 saying, we have a 3-year-old Siberian forest cat, healthy and happy, but she sneezes quite a bit. Is it an allergy due to dust, AC? When should we be worried, or is it nothing to worry about? So sneezy kitty, when is it time to go to the vets?
Here it's a little bit, without a clinical examination, it will be quite difficult to say if it's just an allergy type or is it maybe something infectious, if it's something like a cat flu that is going on. So for that, I would probably say that it's just better to be checked over from a vet. Usually we will be concerned, especially if you will see any kind of discharge from the eyes or from the nose, especially if it's getting very watery or green colored or yellow. That is really a concern. But just to be in the safe side, if it's just an allergy type or maybe something infectious, it's just better to be checked by a vet.
Okay, really hope that helps. Herman, thank you for your message saying, are there oral vitamins available for cats? My cat only eats cooked chicken liver and I'm afraid is not getting the right nutrients. When it comes to supplementation, anything you'd recommend there, Doctor?
Well, depends for exactly what kind of supplementation the pet will require. If it's just general, let's say, vitamins, It depends if the pet actually do really need them or not. So for that, let's say we can run some blood tests, some panels, and see if, for example, if they do need that or not, because with the supplements, there are many for kind of some deficiency in some certain vitamins, or if they need some supplements for joints or for anything like that. Most of the time for a young and healthy patient, we don't really need to supplement with anything. I know that we are used to take supplements just for our, let's say, sometimes peace of mind, just to be stronger and better and healthier. We take supplements, but they don't really need them. They should take everything from the food, especially if it's a good quality food. They should take everything from there. I mean, the boiled chicken liver, that's fine. It's absolutely good food, along of course with some products, dog food or cat food, because they are formulated in a way that all the nutrients, they will be in that food. We can offer them some homemade food as well, of course, just to spoil them a bit, but we don't need to actually replace or the entire meal plan to consist only from human food. We need to give them the proper one.
Hope that helps, Herman. So yeah, there's lots of time and research and development gone into formulating these foods. So if you're able to do a mix, they should be getting everything that they need. Miranda is sounding desperate on the text line. This is the last question of the day, Dr. Nicoleta, because we're talking pet insurance next. Miranda says, my kitten Squeak recently had a tooth extraction and is now enemies with my other cat, Jasmine. Jasmine is gentle and meek and does not fight back. Squeak now bites and scratches. Please help ASAP. Could this be related to the tooth extraction? Could you see a correlation in this behaviour, or is it coincidence?
Depends when was the extraction done. Only if it's still painful, for example, now, and let's say maybe because of the pain, she wants to be let alone or something. But if she's the one who's actually going to attack without being provoked, it should not be related, for example, with the dental. So no, it should not have anything to do with that.
So trip to the vet, check that pain threshold, and otherwise it might be a behavioural thing. And I wish we could help us through a mere text message, Miranda, but wishing you all the best of luck there. Thank you to you, Dr. Nicoleta. I really appreciate your time and insights. Great to get to know you. And thanks for all your answers as well. We'd love to chat with you on a future show. Have a great afternoon ahead.